Hello, my name is Dr. Dewan S. Raja. Today I will discuss about coronary arteries. The coronary arteries supplies the heart. We have two coronary arteries, left coronary artery and right coronary artery. The left coronary artery arises from the left aortic sinus of the ascending aorta. Right coronary artery arises from the right aortic sinus of the ascending aorta. So both the coronary arteries arises from the ascending aorta just above the aortic semilunar valve. The coronary arteries are functional end arteries. There are anastomosis between the branches of the coronary arteries, but they are not sufficient enough to prevent myocardial infarction. So these are not true end arteries. These are functional end arteries that anastomosis is not sufficient to prevent myocardial infarction. There are variations in the distribution of the coronary arteries. Okay, so we have branches of left coronary artery and branches of right coronary artery. Major branch of the left coronary artery is the LAD, anterior interventricular artery. We have also another branch, the circumflex artery here, anterior interventricular artery here, and from anterior interventricular artery we also get sometimes maybe more than one, maybe one lateral diagonal branch. From the right coronary artery we'll get the right marginal artery and the posterior interventricular artery. So anterior interventricular artery is a branch of the left coronary artery. Posterior interventricular artery usually is a branch of the right coronary artery. Right marginal artery is always a branch of the right coronary artery. So if you look at that SA node, the conducting system of the heart, this is usually getting blood supply from the right coronary artery. AV node also get blood supply from the right coronary artery via the posterior interventricular artery. The bundles, AV bundles, are supplied by both the left coronary artery branch like LAD and posterior interventricular artery. This is the interventricular septum. This is supplied by the left coronary artery, anterior 2/3, posterior 1/3 by the right coronary artery. Left coronary artery by the anterior interventricular artery, its branch of the left coronary artery. Right coronary artery branch, posterior interventricular artery supplies the posterior 1/3 of the interventricular septum. AV bundle is getting blood supply from the anterior interventricular branch or LAD of the left coronary artery. This is the right ventricle, this is left ventricle. Okay, so major artery supply of the heart, left coronary artery, we know that origin and area of distribution, left and right ventricle, left atrium, interventricular septum, AV bundle. Right coronary artery again arises from the right aortic sinus of the ascending aorta, and it has area of distribution, right atrium, right and left ventricle, SA node, AV node, most of the conducting system of the heart. LAD, it is supplying the LAD means anterior interventricular artery. There is a branch of left coronary artery. It supplies the right and left ventricles and the anterior 2/3 of the interventricular septum. Posterior interventricular artery, it supplies right and left ventricle and posterior 1/3 of the interventricular septum. Circumflex artery, this is a branch of left coronary artery. It winds around the left border of the heart and continues in the coronary sulcus. Coronary sulcus, the junction between the atria, two atria and two ventricle, and area of distribution is left atrium and left ventricle. Here, variation of the coronary artery. Right coronary artery is dominant in around 67% population. in that the posterior interventricular artery is a branch of the right coronary artery. The right coronary artery and left coronary artery share the blood supply of the heart equally. So this is H-E-A-R-T, heart. Okay, this is a typo. Left coronary artery, dominant pattern in 15% people, in that the posterior interventricular artery is a branch of the circumflex artery. Co-dominance in about 80% of population. Branches of both the coronary arteries reach the crux. Crux is the site of union of the interatrial septum, interventricular septum. This is the area where the right coronary artery turns into the posterior interventricular artery. The branch of the right coronary artery, the posterior interventricular artery branch, is coming at the level of the crux of the heart and gives rise to branches in or near the posterior interventricular groove. So we may get more than one posterior interventricular artery. One may come from the left coronary artery, one may come from the right coronary artery. Okay, coronary artery, right dominant system. This is the posterior, this is the right coronary artery, right marginal artery, posterior interventricular artery. This is a branch of the posterior interventricular artery is here. This is still the right coronary artery. This is the crux area. This is the posterior interventricular artery. So it is a branch of right coronary artery. So here the heart has right coronary artery dominant. Okay. Here, posterior interventricular artery, branch of what? The right coronary artery. And so here the right coronary artery is dominant here. This is the posterior interventricular artery. This is the determinant which artery is dominant. If it is a branch of the right coronary artery like this, then right coronary artery is dominant. If this is a branch of the circumflex artery, there is a branch of the left coronary artery, then it should be the left coronary artery dominant. Okay, here left dominant artery. So we look at the posterior interventricular artery. There is a branch of the circumflex artery. There is a branch of the left coronary artery. Okay, again left coronary artery dominant. Posterior interventricular artery is a branch of the circumflex artery. There is a branch of the left coronary artery. We got the right coronary artery dominance. So, cadaveric heart external surface, the blood vessels are passing over the myocardium inside the epicardium. Epicardium and fatty tissue has been removed from here. We are seeing the coronary artery. Here, anterior interventricular artery, here almost covered by some myocardiac tissue. There is some cardiac muscle are overlapping this area. This is a little bit unusual. Okay, large parts of the anterior interventricular artery is covered by myocardial bridge here. This is for anterior interventricular artery. This is the diagonal branch of the LAD. Okay, we may get another diagonal branch here, maybe more than one diagonal branch. Okay, that is possible. This is the right coronary artery, right marginal artery. It continued posteriorly. Right coronary artery becomes the posterior interventricular artery. There is very usual right coronary artery dominant. There is a conducting system of the heart. These are modified cardiac muscles. That's node, AV node, and they have less myofibrils, less organelle. Okay, so this is supplied by mostly the right coronary artery. This is also supplied by the posterior interventricular branch of the right coronary artery, but under certain circumstances, both of them or any one of them may be supplied by the branches of the left coronary artery. This is the bundle, right bundle, and we have also on the other side left bundle. Bundles are shared by the both anterior interventricular artery and posterior interventricular artery. Both the arteries supplies the bundles. This is the Purkinje fiber supplied by the left and right coronary arteries. Okay, this is an angiogram. We have to find out the angiogram. The right marginal artery is a branch of the right coronary artery. This is the posterior interventricular artery. There is a branch of the right coronary artery. Artery going to the ascenoid is a branch of the right coronary artery. Artery going to the conus arteriosus, that is that conical upper part of the right ventricle, there is a branch of the right coronary artery here. Again, if we compare the normal left coronary artery with that of the ischemic left coronary artery, we are seeing by angiogram, this is narrower kinked, these are narrower kinked, and we have a lot of functional end arteries, a lot of collaterals. Although that is not sufficient to prevent myocardial infarction, these are functional end arteries. This is the site of atherosclerotic plaque or diminution of the lumen of the blood vessel here. We are seeing that. This is different from this. This is healthy. This is the person who has ischemic changes in the, and also atherosclerotic deposition and ischemic changes in the heart, and also atherosclerotic deposition in the coronary artery. Here this is the left coronary artery. Left coronary angiogram, again anterior interventricular artery, we got that. Okay, we got the lateral atrial branch here, supplies the left atrium, the left atrial branch. Okay, and we got the left circumflex artery. We have only one circumflex artery, we may say it's circumflex artery, branch of left coronary artery. So we got the arteries, some arteries perforate the septum and supplies both on the left and on the left and right side. Okay, so we may get the septal artery here. Venous drainage, these are great cardiac vein, middle cardiac vein, and the right marginal vein. The oblique vein of left atrium, left marginal vein, anterior cardiac vein, maybe anterior cardiac veins, maybe 2 to 3, maybe 1, and the vena cordis minimi, these are many. All the above veins except the last two veins drain into the coronary sinus. Into coronary sinus, which opens in the right atrium. That means anterior cardiac vein opens into the right atrium, not to the coronary sinus. Vena cordis minimi may open in any chamber of the heart, mostly in the right atrium. All other vein opens into the coronary sinus. These are the tributaries of the coronary sinus. Okay. Vena cordis minimi open in all four chambers of the heart. Okay, this is the coronary sinus. We got the oblique vein of left atrium. Okay, this represents the embryonic or fetal left superior vena cava. That is a part of the embryonic vessel, like that. The left superior vena cava, it's remnant here. Okay, these are coming from the sinus venosus and the common cardinal vein. Okay, so we got the great cardiac vein. We have this is the middle cardiac vein here. This is the small cardiac vein. This is the right marginal vein. Right marginal vein is a continuation of small cardiac vein, or it may be independent. It may open into the right atrium directly. There is a possibility also. Coronary anastomosis. The coronary arteries are functional end arteries. Anastomosis cannot rapidly provide collateral routes sufficient to circumvent the sudden coronary obstruction. Anastomosis is variable depending on age. In the fetal life, more anastomosis. Due to hypoxia, long-standing bronchial asthma, living in the high altitude, there will be more anastomosis. And also anastomosis is also dependent on atherosclerotic pathogenesis. If there is blockage, then there will be more anastomosis attempt to develop, but these are not very much effective in heart. We call it functional end arteries. Insignificant coronary artery venous anastomosis may also occur. Okay, now let's look at the accompaniment. This is the LED accompanied by the great cardiac vein. This is the great cardiac vein. This is the right marginal vein. We'll get also right marginal artery here. Okay, this is the right coronary artery. Anterior cardiac vein opens directly into the right atrium underneath the right auricle. Okay, left coronary artery has atrial branch, left atrial branch here. Okay, it is a branch of the left coronary artery. This is the area called coronary sulcus, containing coronary sinus and part of the coronary arteries. Accompanying arteries in vein, we just discussed LAD accompanied by great cardiac vein. Here great cardiac vein, this is LAD. Posterior interventricular artery accompanied by the middle cardiac vein. This is the posterior interventricular artery, and the vein is the middle cardiac vein. Right marginal artery is accompanied by right marginal vein. Okay, so right marginal artery, right marginal vein. Circumflex artery may be accompanied by the coronary sinus. It may extend up to this level. This is the coronary sinus. It may come up to this level. Coronary artery diseases, applied anatomy, angina pectoris. This is a condition of ischemia. Person is exhausted. Heart is not getting sufficient oxygen. He has pain in the heart and the chest. If he take rest, or if someone puts some nitroglycerin under the tongue, then the pain will disappear. Even without any nitroglycerin, just taking rest, angina pectoris pain disappear. But pain is severe and lasting in case of myocardial infarction. It may be more than 15 minutes and maybe hours. Myocardial infarction that will damage the cardiac muscle. Coronary artery bypass grafting in case of blockage, like suppose in myocardial infarction, LAD or right coronary artery or the circumflex artery may be blocked. Then what is done? Coronary artery bypass grafting. Then there will be a detour. Another route is opened by using the internal thoracic artery or great saphenous vein or even the radial artery. So if there is no blockage in the coronary artery, then we need a detour, another alternate way. That is done by coronary artery bypass grafting. And what is used? That is the internal thoracic artery or great saphenous vein or radial artery. PTCA, percutaneous transluminal coronary angioplasty. This is the procedure. So catheter is passed to the site of obstruction by atherosclerotic plaque. Catheter contains a deflated balloon. Then the balloon is inflated, and some other devices present in the camera will also remove the other part of, or also remove the atherosclerotic plaque. Then person may get relief because there is no blockage. Three most common sites of coronary artery occlusion: anterior interventricular artery, LAD, also called widow maker, slang language, widow maker, right coronary artery, circumflex artery. This is around 45% cases. This is around 35 to 40% cases. circumflex artery may be blocked in around 15 to 25% cases. Someone may have all three arteries together blocked, then he or she may visit hospital. Okay, this is the lymphatic drainage of the heart. Heart has lymphatic supply, so it comes from the sub-endocardial layer, muscle layer, also epicardial layer. They reaches the anterior mediastinal lymph node. Okay, we go to the from the lymph going through the posterior mediastinal lymph node. Then we have the tracheobronchial lymph node here. Okay, then we have the chain. This chain are the lymphatic drainage chain on the right side, opening into the right intrajugular vein, right subclavian vein. On the left side, it is opening into the junction between the right. Okay, it is between the right intrajugular vein, right subclavian vein. This is the right lymphatic duct, but most of the lymph goes on the left side. Here, junction between the left intrajugular vein, left subclavian vein. And that's all about the coronary arteries. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel, subscribe me. Have a nice, wonderful and blessed day. Bye now.